Hello dear viewers. In last class we have discussed about heart rate calculation from the ECG. Today we will discuss about the determination of cardiac axis, the electrical axis of the heart. Today we will discuss only one method. There are 2-3 methods to determine the axis. Today's class will be more oriented toward the practice of this single method. Then in next class we will discuss the another 2 methods for determination of the axis. What is electrical axis? Basically electrical axis is the resultant vector of any electrical activity during that particular time. Like if there is arterial depolarization, there is production of P wave, then during depolarization of arteria, the resultant vector, the summation of all the depolarization waves or resultant all the vectors will be calculated as a P axis. Likewise, QRS axis can be calculated and T axis can be calculated. But usually if we say that this is cardiac axis, then we say about the QRS axis only. The main axis calculation is for QRS axis. And to calculate the QRS axis, we usually look upon the limb leads, that is lead 1, 2 and 3, that is known as bipolar leads, and augmented vectors ABL, ABR and ABF. The QRS axis is usually expressed in the hexaxial system. If you remember, in basic class we have discussed about that Anthropian triangle and the hexaxial system, and this axis is represented in the frontal plane. This is the hexaxial system, if you remember. Then from the Anthropian triangle we derived this hexaxial system, and for your revision, we say that the lead 1 is from 0 to 180, and the positive pole of lead 1 is at 0 degree. The lead 2 is from plus 60 to minus 120 degree, and the positive pole is at plus 60. And lead third is plus 120 to minus 60 degree, and the positive pole is at plus 120 degree. Likewise, ABL, the positive pole is minus 30 degree, and lead is from minus 30 to plus 150. And ABR, the positive pole is at plus 30 degree, and lead positive pole of ABR is at minus 150 degree, and the positive pole of ABF is minus plus 90 degree. By remembering this hexaxial system, we can calculate the axis of heart. What is the normal QRS axis? Normal QRS axis we consider from minus 30 to plus 90. While minus 30 to minus 90 degree, if the calculated axis or determined axis comes out to be minus 30 to minus 90, then it is considered as left axis deviation. If it comes out to be plus 90 to 180, then it is considered as right axis deviation. And the axis, calculated axis in between minus 90 to plus minus 180, then it is known as northwest axis or indeterminate or extreme axis deviation. What is the value of calculation of axis? We will discuss in next lecture, where we will find left axis deviation or right axis deviation, what are the causes. Today we will discuss only the first and foremost method of calculation or determination of QRS axis. And this method is basically known as Equiphasic method. If you remember, we have discussed that the deflection in ECG, any ECG lead, depends upon the direction of the resultant vector and the viewing point of that lead. If the axis is say plus 90 degree, and we are viewing it in that lead 1 at 0 degree, then the resultant vector will be The deviation in lead 1 will be, net deviation will be 0, and deviation in ABF will be always positive. The main rule is the resultant vector will produce positive deflection towards its main axis. If someone is viewing that particular resultant vector from 90 degree, then the deflection in this perpendicular lead will be equal negative and positive deflection. That is the rule in this particular first method. We have to find the lead with smallest or the equiphasic deflection, this equal negative or positive deflection, or most equiphasic, where the positive and negative deflection are not equal. We will view the QRS complex where the positive R wave and S wave are equal in the 6 leads we have discussed previously. In those leads, we will find which lead is having equiphasic deflection or minimum that net deflection. Then after finding this equiphasic lead, we will see what lead is perpendicular to this lead, and in perpendicular lead we will see net deflection in that lead, whether it is positive or negative. If it is positive, then the axis at the positive pole of that perpendicular lead, and if it is negative, then it is axis at the negative pole of that second lead. Say there are two examples. If the smallest deflection or equiphasic is ABL, if it is ABL, then perpendicular lead to ABL is lead second. We will see the deflection in lead second. If the deflection in lead second is positive, then the axis will be, the cardiac axis will be plus 60 degree. Likewise, if the equiphasic wave is in ABR, this is ABR, the perpendicular lead to ABR is always third lead. Then the deflection in third lead is negative. The negative pole of third lead is at minus 60 degree. Then axis will be minus 60 degree, that is left axis deviation. Now we will view all these things in ECGs. Likewise, we have 6 leads, and in 6 leads we can see that the R and S are almost equal in lead 1. Lead 1 is the equiphasic lead, and now we will see which is perpendicular to first, ABF. We will see deflection in ABF. Deflection in ABF is positive. It indicates the axis is that positive pole of the ABF, that is plus 90 degree. That is how we calculate axis. In this method, we can even correct our axis calculation by adding or subtracting 15 degree. If the equiphasic is not total equiphasic, it is somewhat most equiphasic, there is some positive deflection more or negative deflection more, we will travel towards positive or negative pole 15 degree if it is not the equiphasic one. Like see in this particular example, where the equiphasic lead, or we can say most equiphasic lead, is again lead 1. The positive and negative are almost not equal, but from other leads the net deflection is minimum in the lead 1, but negative deflection is somewhat more than positive. Then again, what is the perpendicular lead of lead 1? It is ABF, and in ABF deflection is positive. It indicates the axis should be around 90 degree. Now there is a negative deflection more in lead 1. We can travel more 15 degree more towards negative pole. Positive pole of first is 1. If here it would have a positive deflection more, then we would have been traveled towards positive pole, but here it is negative deflection more, we will travel towards negative pole of the lead 1 by 15 degree, then axis will be somewhat around 105, 110 degree. Then that is the right axis deviation in this particular example. Then in this example, we can look for the equiphagic lead. It is ABL. ABL is most equiphagic lead, and we all know that the perpendicular lead to ABL is lead second, and in lead second it is the positive deflection. It indicates the axis of QRS complex is plus 60 degree, that is normal axis. In another example, here we can again see what is the equiphagic wave. There are two waves which have positive as well as negative reflection, first and ABL, but usually first is having more equiphagic or that most equiphagic to all, and the perpendicular lead to first lead is ABF, and ABF is having positive deflection. It indicates that it is 90 degree axis, positive plus 90 degree axis in this particular case. Now here to determine axis, again the same example, same first lead is having equiphagic response, and the perpendicular lead is ABF, and ABF is having positive deflection plus 90 degree. In this example, we can have that the equiphagic lead looks to be lead second, and the perpendicular lead to lead second is ABL. ABL is having negative deflection, which indicate the axis is around negative pole of the ABL. The positive pole of ABL is minus 30. The negative pole of ABL is that plus 150. The axis is plus 150 or around that. It indicates it is right axis deviation. That's why third is positive and first is more negative. Then in this last example, the equiphagic lead looks to be this one. This one looks to be ABR. The equiphagic lead is ABR. Perpendicular lead to ABR is lead third. Lead third is having negative deflection. It indicates the axis is somewhere towards the negative pole of the third lead. The negative pole of the third lead is minus 60 degree. It is minus 60 degree. Axis must be near to 60 degree. But here we can say that the deflection is more negative than positive. Then we can even travel 10-15 degree towards the negative pole of the ABR, and negative pole of ABR is at minus 30, plus 30. Then towards first plus 30 from minus 60. Minus 60 is here and plus 30 is here. We have to travel 10 or 15 degrees. So it will be around minus 45 or minus 50. Here the automatic machine have calculated it minus 52. That is how the equiphagic wave, by identifying equiphagic wave and then seeing the perpendicular lead, we can calculate the cardiac axis. In next lecture, we will discuss the two other methods which are more easier but not accurate. There may be sometime mistake. This is the most accurate method to calculate the ECG. Please give your feedback at my WhatsApp number or in this channel as well. Thank you. Thanks a lot.